Hi everyone, my name is Nathan Lamaster, the founder of Smart CU's Hub, and this is the Smart Start Recreational Therapy Insights YouTube channel. Thank you guys so much today for coming on by. We are on week 26, y'all. That means we are halfway to our 52-week goal, which is amazing. We have stayed consistent every week on Mondays posting these, and our plan is to do the same all the way through the year, making this the largest library of YouTube content for recreational therapy around. Now, I'm here at our neighborhood pool, not to jump in today, although I would love to, but to talk about the benefits, safety considerations, and possibilities of programming that you can use within your recreational therapy practice using aquatics therapy. Now, let's make a splash. Why water works. Aquatics therapy isn't just about fun, it is highly effective. And here's why. Okay, buoyancy, which can help reduce joint stress and help those with mobility issues. Resistance, which naturally builds strength and endurance. Sensory input, which can calm or stimulate based off of how you approach it. And confidence boosting freedom of movement for those with physical disabilities. Water transforms the therapeutic environment in ways that dry land just can't. Ideal populations and goals. Aquatic settings can benefit a wide variety of populations. These can include those with arthritis and joint pain, stroke survivors, children with sensory processing disorders, people on the autism spectrum, older adults needing gentle movement. Some common goals can be increasing range of motion and strength, improving balance and coordination, reducing pain or stiffness, or enhancing social skills and emotional regulation. Whether it's physical or psychosocial, aquatic therapy can benefit the client based on how we use it. Now let's talk about some aquatic interventions and considerations. While I'm not demonstrating today's in the pool, I will give you some examples and you can imagine and adapt, okay? Water walking for gait training. What that looks like is somebody walking through the water that maybe has some strength issues in their legs, and what you're doing is helping them balance and coordinate, just walking back and forth throughout the water. Pool noodle yoga. Okay, and that'll add some resistance to the water. So when you push the pool noodle down, it wants to come back up due to buoyancy, right? So using this can actually help with the shoulder straight, okay, and also help with core control. Partnered water toss games for upper body strength and social engagement. So in the pool, it's a great place to throw around a ball, right? Maybe it's a little squishy ball, okay, and you could throw it from one person to the next, and they can practice catching it. Now, if it's an older adult, you might want to throw a beach ball. Beach balls are really big and they come down very slowly, and that means that somebody can reach for them and have more time to do so. You might start with something like that and then work your way to maybe a squishy ball. Floating relaxation with deep breathing for anxiety reduction. I don't know about you, but when I'm in the pool and I'm relaxing, I feel like anything could happen in this world and I will be okay. Maybe that's just my California in me. Just kidding. I'm originally from California, for those of you who don't know. But now I live in Texas. Okay, but remember, success in aquatics therapy comes down to thoughtful planning. Always consider water temperature. You want to make sure your clients are comfortable. Okay? Depth and accessibility. This neighborhood pool would be great because it's about 4 feet deep in the middle, in the deepest point. It goes to 3.5 on both of those sides, so most people can stand in it. Okay. Lifeguard presence. Although this is a community pool, we do not have a lifeguard. So you as a recreational therapist might consider getting lifeguard trained so that you can be available in any type of setting to help people if and when you need to. Individual comfort level and safety levels. So think about, are there any risks around the pool? Like this pool, for instance, has these rocks all around it, and people's feet tend to get kind of scraped up. So you might have people wear water shoes to and from the pool. Okay? Some clients might be non-swimmers. and have trauma linked to water. So you'll also want to consider that. So start with trust and building that relationship with your clients. All right, now let's talk about some documentation and justifying aquatics therapy and recreational therapy for billing. Okay? To ensure coverage and to demonstrate that the value of aquatics therapy, your documentation should show why aquatics therapy was recommended. Okay, so why was it chosen over land-based? This could include, maybe the client strength levels would do better in a water setting where they don't have their full body weight on their joints or their muscles, and using that to gradually build up to where they can do that on land. Okay, could be specific goals that you have for the client. Okay, improve range of motion, reduce anxiety. You want to make sure that those goals are evident in your documentation. It should be observable, so when you write your progress notes, demonstrate what you are seeing, if there's progress or things that need to be adapted and changed over time that you have with the client. Okay, and any safety measures that you recommend for that client in this setting that might be more appropriate in this setting than on land. For example, the client participated in 15 minutes of water walking at a 3-foot depth with flotation belt, improving left leg length by 2 inches compared to dry land. Okay, and you could use that as your justification if that is true for your client. Obviously, you want to make it true to your clients. Okay, and precise language matters. Okay, if we want to continue to bill for services, we need to show that they're effective and why they're useful. Otherwise, they'll be taken away. All right, now let's talk about some contraindications and ethics. Okay, not every client is appropriate for aquatics therapy. Contraindications might include open wounds or infections. You don't want that floating around in the pool, right? Okay, severe fear or discomfort in water. Obviously, we want to make them comfortable. We don't want to produce an anxiety attack. Okay, incontinence. You definitely don't want incontinence in the pool, because then they'll have to clean the whole pool afterwards, and that's no bueno. All right, certain seizure disorders without precautions. Okay, definitely you don't want a client having a seizure in the pool while they're swimming. That could be really deadly. Also, be aware of modesty, privacy, and cultural considerations with your clients around swimwear and co-ed sessions. Maybe that's not appropriate for the guys and girls to be mixed. Inclusion starts with respect. All right, now let's wrap things up for today. Aquatics therapy is more than just fun and splashing around in a pool. Okay, it's a powerful tool used for rehabilitation, engagement, and empowerment. You don't need to be an Olympic swimmer to incorporate aquatics therapy in your practice, because most of the time you're going to be where it's shallow enough where people will walk around. Okay, and you just need to have knowledge of your clients, the settings, safety risks, all that stuff, and be very creative. All right, guys, I'm interested in you. Any of you that are watching this video that have ever used aquatics therapy in your practice, I would love for you to leave in the comments section different types of interventions that you have used that have been effective with your clients, so that other recreational therapists that watch these videos can learn from what has worked in the past and also maybe share some ideas of their own. And as always, guys, please like these videos. That really helps with the algorithm of YouTube. Okay, and hit that subscribe button so that you can see more videos like this each Monday as they come out. And as I said, we're on week 26. We've done 26 of these episodes. So feel free to check out any of the library that we have currently in the next 26 that are coming out in the weeks coming. All right, next week we're going to talk about adaptive sports and inclusion specifically. And I would love for you to come by and let me know what you think. Guys, I hope you have a great Monday, a great week. And as always, recreational therapists, stay classy.